In the patient management, we have the care activity. Under the administration module, we have discussed how to set up care activity procedures. Now let's assign a care activity to a patient. You select the patient, say Betty. Select the activity. We have wound dressing. This is the time this activity is required to be carried out. Here is for your additional notes. And then select the staff, the group, department, or position this will be assigned to. So let's assign it to a staff, let's say Mr. Benson, and then we add. Here, our key activity has been added successfully. Next, we have the diagnosis, indexing, and coding. These are universally recognized codes used to identify medical conditions, procedures, and medications. We have the ICD coding. We have the surgical procedure coding. We have the ICPC coding. Just like the rest, based on what the doctors have diagnosed, a designated staff can add the code for each patient. The doctors can also do this during the diagnosis. These are used for statistical and reporting purposes, classifying diagnosis based on international standardized codes. Next, we have the operation theater. Under the operation theater, we have surgical procedures. This is where you set up different surgical procedures you have in the hospital. Currently, we have CS. Let's add a new procedure. Define the name. Let's say fracture repair. Code S02.1. Add the amount, 100,000. Here's for the GL code. Apply discount, and then report form template, if you have any. And then we add. And here we have our fracture repair procedure. Next, under the operations theater, we have the theaters. This is where you can add the different theaters in the hospital. To add a new one, click on the Add New button. Define the name, say, OR3. Select the building, let's say Building 2. Capacity, let's say 10. And then here is for your additional nodes. And then you add. You can see we now have OR3, Building 2, and the capacity is 10. Next, we have the surgery request. This is where you can book a patient for an operation. Let's add a new surgery request. Click on the Add New. Select a patient. The billing type. This patient is under a family account, so we select that. The specialist or consultant, I select this person. Surgery type, I'll select fracture repair. And then we add. Next, we have the operation scheduling. From here, you can see the unscheduled operations. We click on Schedule Operation. Select an appointment date. Select the operation theater. Select the time for the operation, let's say from 7 to 9. And you send notification to staff, group, department, or position you choose. Let's send a notification to a staff. Say Dr. John. And then we save. We come under the scheduled operation. On the 8th, we can select the date from here. Then we have the operation. You can edit the scheduling to change the date of the operation. You can cancel the surgery. You can check in for operation, view details, add the reports, or add activity. Surgery care activity procedures are a range of activities that occur before, during, or after a surgery procedure. Under the Administration module, we've discussed how you can set up different activity procedures. For the purpose of this demonstration, let's create an Operation Care activity, and then we can add it here. Click on Care Activity. Let's add a new procedure. Let's say surgical preparation. Preparing the patient for surgery, which can include skin cleansing, anesthesia administration, and positioning. For the code, Z48.81. For the cost, $20,000. I'll leave the GL code blank for now. No discounts. Then I'll mark it as a surgery activity. This is what makes it a surgery activity. And then I'll add. Over here, you can see the surgical preparation. Now let's go back to the operation scheduling and add this activity. Under the Scheduled, on the 8th, we'll add activity. Select an activity. We select the surgical preparation and the time it will be administered. This operation is scheduled for 7. Select the time it will be scheduled. Here's for your additional notes. And then we add. Next is to check in for the operation. From here you can select the date. Consent given. Yes. Indications for operation. Let's say emergency. Blood cross-matched. You say yes. This is to indicate that we have this patient's blood type available in the hospital. If there is any lab linked to this operation, you can reference the lab result here. The same for X-ray. You can type in the anesthesia type that was administered. You can select the surgeons for this operation. As many surgeons as possible. You can also select assistants, anesthesia, nurses, scrubs, other personnel. You can always edit this after the operations because more people might join in when the operation has already started. Let's save this for now. Also from here, when we refresh the page, after the operation, we can always come back here and check out from the theater. So from this checkout option, you can add the actual time that the operation started. The operation was scheduled for 7, but it started at 7:30 and then ended at 10 o'clock. You can add additional details. If there are more surgeons that joined the operation, you can add them here. Add the assistants and every other information, and then complete the checkout and save. Next, we have the surgery inquiry. This is where you can find the operations that have been performed in the hospital. You can filter it based on theater. Let's select the OR3, and this is the one we just performed. You can view the surgery activities. You can see that on this date, there was a surgical preparation for this patient. You can also see other details of this operation, like the operation type, the date it was scheduled, the theater the operation was performed in. Lastly, under the operations theater, we have the price listing. This is where you define the price of the surgical procedure for each of the HMO. So we edit the price list. You can say for this HMO, this operation will cost $80,000. And for this HMO, it will cost $75,000. And the same way for all the HMOs that are active in the organization. Next, we have the documents. Under the administration model, we have discussed document folders where we set up the reference folder. Over here, you will see all the documents in the system and the patients that own them. You can select a particular folder to filter the documents. Let's add a new document in the clinical reference. Click on the Add New. Select the patient. Let's say Austin. For the document title, select blood group. Select the document dates. Now browse the document. Let's say lab result. And then we upload. And here you can see the document. You can also view this document in the clinical record of the patient, under the clinical records. And we'll search for a patient. Select the patient. And under the documents, you can see we have one document. And this is the blood group result we just uploaded. You can also delete this document by right-clicking on it. You can either download or delete. Next, we have the live chat. This is where you can directly chat with a patient or a staff member if they are online. We have the care activity price listing. Just like every other price listing, you can edit to add the prices for each of this procedure for different HMOs the hospital works with. Next, we have other consumables. These are products that do not need to be prescribed by the doctor. They can be ordered from the pharmacy. To make a request, select the patient you want to use this consumable for. And then select the location you are making the request from, say Central Pharmacy. And then select the requirements. Let's say we want to request for a bandage. Request for small bandages. And the quantity, let's say 1. You can add new with this button. So you can request for a syringe. You can say 50 milliliters. 2. And then you can add. And that's successful. Next, we have the live video chats. This is where you can have a video call with a patient for remote consultation. You can use this button to invite a patient. Lastly, under the patient management module, we have the other prescriptions. From here, you can find a patient that is on medication, and then reorder the prescription.